Hello, YouTubers. Joe Kersey and Paul here at nearly 1700 in the afternoon Eastern Daylight Time on what day is it, Paul? Good Lord. It's Wednesday.
Wednesday the 29th.
Wednesday 29th, October 29th, 2014. And we've been watching Prime Minister's Question Time, and we recently the last bit of discussion. There are a couple of questions about the National Health Service over there. That's Paul. Now we were talking about. Well, the National Health Service. And I really haven't talked too much about the sense of why an individual my age, I'm 62, would go into medicine. Well, I ended up, when I graduated from medical school in 1975, I came out of a group of kids. Well, when you grew up, you grew up in seeing other docs in town and so forth, and there's sort of an ethic there. There's an ethos there. There's an assumed ethic and ethos.
You're all independent.
Well, yes. Well, yes.
You're all independent, but it's coming to the point now today you're not. All these doctors are like docs in a box. I mean, like where I get, there's like up to 8 doctors down there, and they all work in one place. And it's whatever they bring in and stuff, it's more or less what they live off of.
Well, no, actually, no, they're salaried hired hands.
Yeah, because they're like hired.
Well, yeah, no, I mean, in the olden days, what you brought in was what you lived off, but now now you're a hired hand.
Right.
Yeah. And
it's like a bartender they keep bartenders and waitresses, and they collect tips, get tips and stuff. Well, they have to all put them in one big kitty.
Well, it'll be interesting to see
an equal amount.
It'll be interesting to see if it comes to the point that the docs at these dock-in-a-box joints and hired hand joints put a tip jar out on the front table.
On the reception.
Yeah, on the reception desk to see if you get.
Tip us if you like it.
Yeah, tip us if you like it. Did we help you? Did we solve your problem?
Did we help you today?
Listen, I'm going to tell you right now. I've been a hired hand about 3 or 4 times in my life, and there's not a daggone thing wrong with that. And when I was a hired hand, I was a hired hand, and I gave my best work that I could, and that was fine. And I didn't think anything. I didn't feel like I was demeaned by it or that sort of thing at all. But that's not how I wanted to make my living. And I think certainly the guys that went into medicine prior to me and maybe a couple of years after me went into the practice of medicine, assuming that they'd be independent practitioners and not have to be paid by some sort of corporation or entity,
right?
Third-party entity.
Correct.
And there's a different sense of how you deal with people. Well, not patients, because you take care of the patient. You always take care of the patient, but just how you approach going into work. If you realize that you're in control of your own income, as opposed to some corporation or higher entity, some
Right.
larger entity. And again, there's nothing wrong with that. If you want to submit, put your fate in the hands of a larger entity, that's fine. But that wasn't the sense that prevailed when I was growing up and going into the practice of medicine. And now I have a feel. See, this is this gets back to watching the stuff about the NHS on the UK Parliament just now. The people over there, as far as I can tell, really like their National Health Service. As near as I can understand, their docs and that National Health Service are hired. I mean, they're just paid employees. I mean, they are paid employees.
Right. They work 8 hours a day.
Well, I don't know what their I don't know what their hours are, but they're paid employees. And yeah, some of them, I guess, can have independent private practices to some extent outside that, but that's not what I'm talking about. So, golly, so there's a mentality there that is different from somebody like myself that went in that, I want to have my independent practice. You want me to do a case for you? I'll do a case for you. And I was able to do that, fortunately. But it was rapidly drawing to a close. And of course, one of the reasons why I retired so early was that the hospitals were trying to drive independent guys like me into groups that were actually controlled by the hospital, owned by the hospital, and.
Right, that would make you then an employee of the hospital.
Yes, a hired hand of the hospital.
Instead of an independent.
Instead of me practicing
for you.
Yes, I would be practicing for the hospital. Which basically means I'm not practicing for the patient, I'm practicing for the hospital.
Right.
See, when I'm practicing for me, I'm practicing for the patient. If I decide not to bill the patient, I just don't bill the patient. And
right.
I did that, a number of times.
Yeah, but
probably about 20% of the time. And when you get right down to it. But could I say to my employer, oh, don't bill this person because they have a problem paying? No.
Well, then you pay for.
Yeah, well, that
you pay.
Well, I don't know what they would have said. That's an interesting point, Paul, because fortunately, since I didn't roll over to these guys.
It's probably what it would amount to. Well, if you don't think we should charge you, then we'll charge you.
That would be
for what year.
That would be the logical consequence, wouldn't it?
You're expected to get paid.
Yeah. Low lives.
Yeah, that would really suck.
Low lives. I've been berated for using the term low lives, but I'm going to tell you right now, there are a lot of low lives out there that aren't coming into your house through your window threatening to kill you.
No, they're in business.
Yes, they are. Well, so it's a different mentality, but it occurs to me, and Paul deals with this when he goes to doc far more often than I do, unfortunately. But fortunately, he can go without having to pay for it because of his insurance. Well, he pays for it because his insurance is deducted from his pay. But nonetheless, I mean, it's helped him a lot. You were making the point that these folks don't seem to care about whether they're independent or not.
Right.
Would you care to elaborate on that?
Well, okay. The doctor I was seeing before, the one I am now.
Yeah.
Okay. If you canceled your appointment, you still had to pay them for that appointment.
It was like $25, wasn't it? Something like that. Oh, it was more?
Yeah,
It was more?
it was almost $80.
Oh.
Now, this one, she doesn't care.
Because she works for
If you
I see.
If you cancel your appointment, you don't pay for the appointment.
Well,
If you're late a couple minutes, 5 minutes for the appointment, you don't still, they don't tell you, sorry, come back later.
we're kind of under
and
my.
still pay for the $80 appointment.
You're kind of undermining my point. No, the point you're making is that an independent contractor could screw patients better than the hired hand people can.
Right.
Oh.
The guys, the one I'm seeing now, I was telling her.
It's
I was
an
asking
interesting
her
contrast,
about that,
isn't it?
About that toy. And I never heard of such a thing. And I said, yeah.
Well,
I said, if you're 5-10 minutes late at the last place, I said, you still had to pay for the appointment even though they would send you away.
well, yeah.
Because you missed the time that you were to be there.
I understand, but I have a feeling that well, I don't know, but you're presenting that as an independent practitioner's policy.
I don't know.
Well, if he is, he just directly contracted my main point. But there it is. That's okay. Make your point. Have your say.
I don't know if that one was, but that's how they work down there.
Okay. Well, yeah. I mean, if that's your experience, that's your experience.
Right.
Yeah.
And now, if you're late, okay, wait until there's another spot, or we'll do it again another day.
Nothing good happens at the pest house, either in its outer environments and certainly not inside. Let those with ears hear. Anything else, Paul?
No, that's pretty much it.
Well, this is what happens when you spend a lot of time listening to the UK Parliament, which is considerably thinned out now that the Prime Minister has left.
Yeah, pretty much.
Yeah.